Welcome to the setup and calibration of the Sensormedic 3100A. This is a high frequency ventilator which is used most frequently in neonatal. Now let's take a look at some of the controls. You're going to be looking at the flow, liters per minute, also the mean pressure, limit and adjust knobs, two of them, frequency, and you can change that with a knob to the right, inspiratory time, knob to the right, and then amplitude, and that's changed with the power control, which is also on the right. Now you see the mean pressure digital display, the stop-start button, and then we're going to look at the piston position. Now the piston position is controlled elsewhere. Let's take a look at some of the alarms on the Sensormedic ventilator. First, we have the adjustable set max airway pressure and set minimum airway pressure, each having a red indicator light when it's been violated. We have a preset high pressure of 50 and a preset low pressure of 20 with red lights for each of them. Then we have a silence button of 45 seconds and a reset power button fail down there, as well as 4 indicator lights. The source gas is low, the battery low, the oscillator overheat, and the oscillator stopped, which is a red button. This is the Sensormedic 3100A. Power button is down there, and okay, so the patient circuit calibration, these are turned to max. Flow is at 25, 20. Okay, and then we pressurize until we get to, we have to be at
greater than 39.
Greater than 39, and that's at 48. So then that indicates that we have no leaks in the system. Okay, and now to start it.
Now you want to turn this so that we get a pressure of 19 to 21.
Okay.
And this needs to be at 6.
Okay.
Is it? You can barely
6,
see it.
yeah.
Okay. And then you can start oscillating.
Okay.
And depending on where your altitude is, you want to check what your amp is. And for us, anywhere greater than about 52 looks good.
Okay.
And we just have to make sure that it's centered. It looks like it's centered. Just over a little bit. There we go.
So adjusting centering down there. Inspiratory time typically 0.33.
0.3. Frequency is usually 15.
Okay. So now this would be totally ready.
Ready to go.
Okay.
That's it.
Take a look at some of the other functions of the ventilator. On the left you have the air oxygen blender, and on the right the humidifier. Then underneath the control panel you have the control line, the dump line, the air pressure line, and the limit line. Then that's followed by, on the pole is the piston positioning and the on-off. Now the big round black part is the diaphragm that moves, and then here you can see that we're using very short but very stiff tubing so that the maximum pressure is delivered to the child. Okay, yeah, we can just barely see that vibrating the test line. That's going at a rate of...
It's at an amp of 30, which is pretty excessive. Okay. I just try to exaggerate.
Sure. Oh, there. Cool. Need a Draeger baby log. Draeger screen. We'll get back to it in a little bit. Ventilator circuit. Test load. Notice the difference compared to the oscillator.